There are two major changes in immigration rules that the government announced last week for care workers. Now, the first one is that care providers who want to sponsor any foreign worker should first consider those people who are in the UK. So they have to prioritize people in the UK first before anybody outside the UK. It means that they have to provide proof that there's nobody that needs that job in the UK. That's why they want to sponsor someone who is outside the UK. The second one is that they have increased the minimum salary threshold from 23,200 to 25,000 pounds. These rules will take effect from April 9th, 2025. So is it good news for you or bad news? I know that depending on your immigration status, you might receive this as bad news, or you could say it's good news. Now, in this video, I'm going to share some insights on how it's going to affect international care workers, people who are care workers in the UK whose license has been revoked. Please watch this video till the end, as well as those people who want to come into the UK. What does this mean to you? If you're meeting me for the first time, my name is Cynthia. I share information about settling, working, or studying in the UK. If you're interested in any of these, then subscribe to this channel, turn on your notification bell so that each time I drop a new video, you'll be amongst the first people to see that video. And if you need support with CV, cover letter, supporting information, anything that will help you land a visa sponsorship job, then click on the link or access the link in the description as well as in the comments. Reach out to me. Don't be alone using the same wrong CV and cover letter or supporting information to apply for jobs over and over again and you're not getting any response. If you need help, reach out to me and I will support you. And without wasting time, let's get into this video. If you have a health and care visa and your sponsor's license has been revoked, you will see this as good news. Yes, because it's less competition. You're not competing with anybody outside the UK. They will concentrate on you first before anybody. Now, last week, I released a video about a document the government sent. They want people to have access to this document. I made a video about it. It says that you can actually get support if you need support with your CV, cover letter, or maybe you need someone to talk to. Maybe confidentially, you want to talk to somebody about your situation in the UK. You can call some numbers there. I'm going to just put the link here so that you can have access to that document. Please, if you've missed it, have access to it. You should not stay alone and become depressed and mentally ill because of your situation. It's not the end of the world, but the government is saying they would support you. For the bad news, it's bad news for those people who have been receiving MVQ trainings outside the UK. They've spent a lot of money on IELTS, driving license, trying to see if they can get access to a health and care visa. They want to come into the UK to render their services. It's bad news for you because the number of times you would have to submit an application to land that job has increased, in fact, because it's going to be more difficult. Let me be sincere with you. It's going to be more difficult for you to come into the UK. Many employers will struggle to make a convincing argument that they need you instead of taking somebody who are already here in the pool of people who don't have a job. It's going to be very difficult to make a convincing argument for you. So if you're spending money already paying for COS, just note that you're wasting your money right now. From 9th of April, the employer or your care provider has to provide that evidence. Without that evidence, you will not be employed. So it's difficult right now because there are thousands of people whose employer's license has been revoked. They are looking for jobs. In fact, it is really a tough situation for them. At the same time, it's going to affect many nurses who have written IELTS severally. They've done it a lot of times. Unfortunately, they've not been able to pass it. And so they are thinking, I would come in as a carer. Once I come in as a carer, I'll get enough money to pay for IELTS and write it again. There are many nurses who have used this pathway. They've come into the UK, they've worked as carers for a few months, a year, and then they get their OSCE, their CBT, and their IELTS, and get in their license, NMC license. It has happened to a lot of people, but unfortunately it's bad news for them. It's also bad news for international students who want to switch to the NHS. On the NHS employers website, they've already announced that they would not be sponsoring entry-level band 3. So health and care entry-level band 3 will not be sponsored because of this problem, because they've increased the minimum salary threshold to £25,000, and we already know that band 3 is £24,071 as the entry level. So they will only sponsor those people who are in the pathway and would enter band 3 step 2. That's the higher level. So this is bad news for international students. There are many people who have come in without their families. The hope is that while they are students, they will work so hard, then they will get into the NHS, because the NHS is 6131 occupation code, which means you can bring your dependents into the UK. But unfortunately, with this that has happened, it means as a student, you can't switch to the NHS. And it's a serious problem, seriously, because if you cannot switch to the NHS, you've been separated from your family, you now go into a post-study work visa without your family, because you can only bring the dependents that followed you through the student route into the post-study work visa route. It is heartbreaking for so many families. Let's just be sincere. There are thousands of international students all over the UK who want to switch into care. And this is the problem. But I just want you to know that there are some private organizations that offer 6131. Please, if you know any private organization that offers 6131 occupation code for care, just put it in the comments so that people will learn and they'll just try and see if they can have access to it. Yes, they do exist, but they are just a few of them. It is good news for those people whose sponsor's license has been revoked. It means there is less competition for you in the NHS. You can switch to band 3 entry level with that £24,071. Why? Because the government says that this would only affect those people coming in newly into the pathway. It's not going to affect people who are already in the pathway. You can switch to the NHS without that increase in minimum salary threshold affecting you. Less competition for you because the students cannot get those codes. Yeah, that's what it means, that's what it means. But I feel there's a big disconnect between the NHS and the government, because if you check the statement of changes in immigration rules, it appears as if they will sponsor band 3. See, this thing happens all the time between April and October or November. Before they increase the NHS salary, it's like a cycle. Between April and October, they will sponsor a few people, they will not sponsor a lot of people. So that's why the NHS said on their website, because this is the period when there is this large number of rejections by caseworkers. Caseworkers are those people that handle your visa application. They decide whether they would approve it or not. So some caseworkers will read what is on the statement of changes in immigration rules and tell you that, hey, your visa will be approved because band 3 can be sponsored. We can see it here. It's clear for us to see. While some other caseworkers will read it and say, no, your visa will not be approved because the NHS is paying you £24,071 while the government is saying it's £25,000. Please, if there's anybody that can solve this problem for us, let them solve it, because it does not make sense to lose a large number of talented people between April and, and October. There are some people on post-study work visa that want to get into the NHS for the first time, and this is a fantastic opportunity for them. Then this now happens. It's not really fair. I feel it's not fair. If there's anybody that can help and fight this and make there be a clear connect between the government and the NHS, please, people should fight for people to get in and support themselves. They've been separated from their family for a very long time. There are support workers, carers who are working in different places with their post-study work visa, and you are telling me that they should not get into the NHS and bring their loved one. You stay with, oh no, yeah, it's not really nice. It doesn't make sense in my own opinion. But this is what it is, guys. I don't know. What are your thoughts? Is it good news for you or bad news for you? Just share it in the comments. Let's just be sincere that this pathway is slowly coming to an end. it has blessed a lot of people. This is England. Almost 1.3 million people are on disability benefits or allowance. It tells you that a lot of people need support with care. Now, apart from that, 12 million people are above the ages of 60. So it means that they need support. 12 million is a large number. Some of them need support, some of them don't. But that's obviously the reason why many people have come into the UK to offer their services. Many people are working as support workers, healthcare assistants, people who are clinical support workers, maternity support workers. There are just a lot of support workers who are helping this nation, taking care of people who need care in this country. So, yeah, I don't know. I'm just saying that it's going to be more difficult for you to come into the UK because of these changes in immigration rules. I don't know what you should do. Some people say, should I apply? I think you should apply. Just prepare yourself that it takes a lot of effort to land that job, much more than ever, because it's going to be more difficult for people who are outside the UK. If there's any changes in the NHS website with regards to them supporting maybe health, international students or those people who are on graduate visa to be able to get access to sponsorship in Band 3, I will update you on this channel because I really want people to be united with their families. Anyway, I'll see you in my next video. Bye-bye.